One complication that has puzzled doctors treating patients with COVID-19 is blood clotting. I am joined by Dr. George Goshua, an expert in blood cancers from the Yale Cancer Center and Smilow Cancer Hospital. Thank you for being with us.
Thank you so much for having me on the show.
So you've just completed a study on why blood clotting could be happening to COVID-19 patients. What did you find?
So we wanted to take a look and see what's happening to the blood vessels, the highways where the blood flows through. And we want to see what's happening essentially to the guardrails on the side of these highways. And what we found was that indeed in patients who contract the SARS-CoV-2 virus, these guardrails do go down, both when patients are less sick and then when patients are even sicker, there's more damage.
So that was something important, I would think, for people to know, that even if you have a mild case, you might have this risk. Explain to people also why blood clots are so dangerous.
Yes, of course. Even if you have a mild case, yes, indeed. With this research, we know that you do have a higher risk. Blood clots are dangerous because they can form in the legs, they can travel to the lungs, they can lead to cardiac arrest. And then the last bit that I do want to add too is that in this particular disease, we know that blood clots also form in big vessels, but also small vessels, which can be even more dangerous.
Yeah, so if you're the average person and you're concerned about this, and perhaps you find out you have COVID-19, what should you do?
So I think standard precautions, as you would normally do, I do think that it is really important as much as possible to wash your hands, wear a mask, and try to protect you and your family in that kind of way. With regards to the research conducted at the Yale Smilow Cancer Center and at the Yale University School of Medicine, we want to be clear that this research does apply to individuals who are hospitalized. So if you're hospitalized with COVID-19 infection and you have evidence of some kind of damage to your blood vessels, we will be treating you accordingly.
Okay. Good to know, and interesting as you find out a little bit more about some of these other side effects. Thank you for being with us, doctor.
Of course. Thank you for having me.